All right, ready to dive deep. Today, it's all about how Ayurveda tackles chronic liver disease.
Oh, fascinating.
We're going with some awesome research straight from the International Journal of Ayurveda and Pharma Research.
Okay.
Specifically, an article called Ayurvedic Management of Chronic Liver Disease, CLD, an analytical review.
Nice.
So if you've ever wondered how ancient wisdom handles a modern health crisis, get ready.
It's a really important topic, especially with how widespread liver disease is globally.
You're telling me? This article doesn't sugarcoat anything.
Right.
Did you see that cirrhosis alone causes a crazy number of deaths worldwide?
It's a big problem, yeah.
In India, it's 22.2 deaths per 100,000 people.
Wow.
And that's according to the World Health Organization, no less.
That's a serious statistic.
The article really zeroes in on one of the biggest culprits, too, and that's alcoholic liver disease.
Yeah, we know excessive drinking does damage, but this research really digs deep into the impact it has on the liver, heart, and kidneys.
It's a serious wake-up call for all of us, isn't it?
Trish.
But it's not all about alcohol.
Right.
Hepatitis B and C, they also play a huge role in this whole global health challenge.
Absolutely.
So how does Ayurveda even begin to approach something this complex?
Well, for starters, it recognizes how interconnected everything is in the body.
Okay.
The article uses the term Yakar, which basically highlights the link between a messed up liver and that physical symptom of having a distended abdomen.
So they're connecting what we see on the outside with what's happening inside.
Exactly. And they go even further, suggesting that in Ayurveda, cirrhosis is often linked to these conditions called Kamala or Kumbhakamala,
Okay.
which are actually described in ancient texts.
So there's this whole ancient system of understanding, but how does that compare to what modern medicine says about the liver? Are they on completely different pages?
Not at all.
Really?
It's fascinating how much Ayurveda overlaps with modern medicine in terms of emphasizing the liver's vital role in metabolism, detoxification, basically keeping the whole body running smoothly.
Okay, so there's some common ground there.
Definitely.
But Ayurveda obviously has its own unique perspective, right?
Absolutely.
So what's their take on how the liver actually functions?
Well, the article gets into alcoholic liver disorders specifically,
Okay.
breaking them down into fatty liver, alcoholic hepatitis, and of course, cirrhosis.
So they acknowledge the different stages of damage.
Right?
But what makes Ayurveda's approach unique? What's their angle?
They put a lot of emphasis on pitta. This dosha related to fire and metabolic processes.
Okay.
It governs digestion, metabolism, all those transformations happening in the body.
Right, so if pitta is off balance, it makes sense the liver would take a hit.
Exactly.
It's such a metabolic powerhouse and all.
Exactly.
But how do you actually do something about that? What does Ayurveda suggest for managing cirrhosis?
Well, they're all about getting to the root cause.
Okay.
So no surprises here, given what we've discussed.
Right.
But step one is absolutely no alcohol.
Makes sense. You can't heal if you keep adding fuel to the fire. But what else is in their toolkit?
They actually recommend avoiding certain medications like NSAIDs, paracetamol, and steroids.
Oh, those are tough on the liver even when it's healthy.
Exactly.
Are there any specific dietary recommendations too?
Absolutely. They're strong advocates for a low-salt diet, mainly to help with ascites.
Ascites.
That's the fluid buildup in the abdomen.
Right, right. So keeping that sodium in check is key.
Definitely.
But here's where I get really intrigued. The remedies themselves. Ayurveda is famous for its herbs and formulations. So what are the stars of the show when it comes to liver health?
Well, they highlight a few single herbs that have a long history of use, like haritaki, daraharidra, and bhumyamalki.
Okay, I'm all ears. What makes them so special? Do they each have a different superpower?
You could say that. Each one has unique properties that are thought to benefit the liver.
Okay.
Haritaki is known for its detoxifying and rejuvenating effects,
Interesting.
while Dorahara is considered anti-inflammatory and actually protects the liver from damage. It's hepatoprotective.
Gotcha.
And then you have bhumyamalki, which has antiviral properties and can even help regenerate liver cells.
It's amazing. Nature's medicine cabinet is pretty impressive.
It is.
But it's not all about solo acts, is it?
Right.
What about those compound formulations I've heard of?
Right. Those take the benefits of the individual herbs and kind of amplify them.
Okay.
Their article mentions Fultricati Quath, which combines 8 herbs to create a stronger effect.
I like that. It's like an herbal dream team.
Exactly.
So what other dream teams are out there for managing cirrhosis?
They talk about a few others like Amita Swaras, Panchtikta Grita Gugulu, and Kumaryasev.
Okay.
each with a specific role to play in addressing different aspects of the disease.
Wow, so there's a whole arsenal of herbal weapons.
Right.
But what about those complications that can come with cirrhosis? Does Ayurveda have anything for those?
It does. They discuss shotha, which is the Ayurvedic term for ascites,
Okay.
and formulations like Rahit Loknath Ras and Punarnava Mandor are traditionally used to target that fluid buildup.
Interesting. So how do those work? What's the thinking behind them?
Well, they're thought to have diuretic and detoxifying properties.
Okay.
So they help flush out excess fluid and toxins from the body, which reduces the ascites.
It's amazing how these ancient systems had such a sophisticated understanding of the body.
Yeah.
But I have to ask, is there any modern science backing this up? Are there actual studies that show these treatments are effective?
There are.
Yeah.
And that's where things get really interesting.
Okay.
The article highlights case studies and research findings that suggest these treatments can be incredibly effective.
Wow.
We're talking about real results, even in cases of hepatitis B and alcoholic liver disease.
All right, now that's what I'm talking about. Hard evidence.
All right.
Let's dive into those success stories when we come back for part 2 of this deep dive.
Sounds good.
You won't want to miss it.
Definitely not.
Okay, I'm ready to hear about these success stories you mentioned.
Oh, absolutely.
You really had me hooked with those actual results.
Yeah, one case study that really jumps out involves a hepatitis B patient.
Okay.
They were treated with this combo of Arogavardini Vati and Bumyamalki juice.
Right. Bumyamalki, that was the one with the antiviral and regenerative properties.
It's a fact.
Like a superhero herb.
Pretty much, but hepatitis B, that's no joke.
It's not. So what happened? What kind of impact did they see?
Well, after the treatment, the patient's hepatitis B surface antigen, that marker showing an active infection, it was gone.
Seriously.
Gone, completely disappeared.
Oh.
And their liver enzyme levels, which are usually all out of whack with liver disease, they went back to a normal range.
Wait, are you saying they cured the hepatitis B?
The results were definitely remarkable.
That's huge.
Yeah, it really highlights the potential of these targeted herbal treatments.
Yeah.
But the article also gets into the research on a more well-known formulation, Liv.52.
Liv.52. Oh, yeah.
Yeah.
I've seen that one around.
Have you? It's
Yeah.
more than just hype, that's for sure.
Is it?
Liv.52 has been studied like crazy. We're talking over 24 clinical papers and 92 experimental studies looking at its effectiveness for all kinds of liver problems.
That's a lot of research.
It is.
So what kind of conditions are we talking about?
Well, the research suggests it could be helpful for both preventing and treating viral hepatitis.
Okay.
It can protect the liver from damage caused by tuberculosis meds,
Wow.
and it can even help manage cirrhosis and alcoholic hepatitis.
So it's like a multi-purpose liver support.
In a way, yeah, it seems to have a pretty broad range of uses.
That's amazing.
But on top of all those lab results and clinical trials, the article also has some case studies that focus specifically on cirrhosis.
Okay, now we're getting to the real world stuff. Tell me about those.
All right, so one study looked at a group of patients with alcoholic liver disease and cirrhosis. They got the whole Ayurvedic treatment package, herbal formulations, dietary recommendations, lifestyle changes.
Wow, the whole 9 yards.
Exactly, a truly holistic approach.
Not just masking the symptoms?
Nope, addressing the root cause.
And what happened?
The results were super encouraging.
That's great.
The patients said they felt way better, less fatigue, less jaundice, and less of that abdominal swelling we talked about.
Fantastic. But did their liver function actually improve?
It did. Their liver function tests showed positive changes, meaning the treatment was actually helping their livers heal.
That's amazing. It sounds like Ayurveda is more than just some mystical, ancient practice.
Oh, for sure.
There's real science emerging to back it up.
Absolutely. And the research is only going to keep growing.
That's great.
It's fascinating to see how modern science is starting to validate this ancient wisdom.
Yeah, it's like bridging the gap between two worlds.
Exactly.
Taking this ancient knowledge and giving it a modern scientific foundation.
Exactly. And it speaks to the importance of being open to different approaches to health.
Yeah.
Especially for something as complex as cirrhosis.
Totally agree. There's so much we can learn from these traditional systems like Ayurveda. But speaking of learning, there's something important the article emphasized that I think our listeners should hear.
Oh, what's that?
It stressed that Ayurvedic treatment for cirrhosis isn't just about taking some magic pill.
Right.
It's about making real changes to your lifestyle.
That's so important.
Yeah, Ayurveda recognizes that our physical health is totally tied to our mental and emotional well-being.
That's all connected.
So while herbs and formulations have their place, it's just as important to look at things like diet, stress, exercise,
Definitely.
all those things we often take for granted.
It's about creating a lifestyle that supports healing.
And that's a message that applies to everyone,
Hobby.
whether you're dealing with a health issue or just want to live a better life.
Absolutely. It's about being proactive and taking a holistic approach to your well-being.
Well said.
Thanks.
This whole deep dive into Ayurveda and its take on managing cirrhosis has been eye-opening.
It has.
We've covered so much, from understanding Ayurveda's perspective on liver disease to those promising research findings.
It's been a great journey, weaving together ancient wisdom and modern science.
It really has. But before we wrap up, I want to leave our listeners with a question, something to think about as they keep exploring this topic.
All right, hit me with it.
Given the growing interest in holistic health and the encouraging research on Ayurvedic treatments, how could these approaches work with conventional medicine in the future of liver disease treatment?
Now, that's a great question.
It is, isn't it?
It opens up a whole new conversation.
Exactly.
Yeah. I like it.
Well, on that thought-provoking note, we'll wrap up this part of our deep dive.
Okay.
Stay tuned, though, because in part 3, we'll be going deeper into the applications of this Ayurvedic approach.
Awesome.
And what it could mean for the future of liver health. Back again for our final deep dive into Ayurveda and liver disease.
It's been quite a journey.
It has. But before we get too lost in the big picture, I want to make sure we bring it back down to earth for our listeners.
Okay.
Beyond all the herbs and cool formulations, what really hit home for me was Ayurveda's emphasis on lifestyle. It's not about just treating the symptoms. It's about getting to the root cause.
Exactly. Ayurveda really stresses that connection between our physical, mental, and emotional well-being.
Right. It's not just about popping a pill. It's about making smart choices to help your body heal itself.
Exactly.
Like we said before, diet, stress management, exercise, all of those things are crucial.
They are.
It's almost like Ayurveda is more of a way of life than just medicine.
I think that's a great way to put it.
It's a whole philosophy about finding that balance and harmony in every part of life.
Yeah.
And that's something we can all benefit from, right?
Right.
Whether we're dealing with a health problem or just trying to live a better life.
Absolutely. It's about realizing you have the power to influence your own health.
Exactly. And speaking of that power, that question I asked at the end of part 2 is still on my mind.
Which one?
About how this Ayurvedic approach, with its focus on holistic wellness, could actually work with conventional medicine.
Oh, yeah.
You know, the future of treating liver disease.
That's a big one, and it's one that researchers are starting to dig into.
Really?
Imagine a future where doctors don't just prescribe meds,
Right.
but also guide patients towards making lifestyle changes that actually help them heal.
Yeah, giving them personalized advice on diet.
Right.
Or stress reduction techniques.
Exactly.
Maybe even incorporating herbs in those formulations alongside conventional treatments.
That's the idea, a truly integrated approach.
Combining the best of both worlds.
Exactly.
For a more complete and effective plan.
I think so.
And the possibilities are amazing.
Definitely.
We could see better outcomes, fewer side effects,
Hopefully.
and patients who are more empowered.
For sure.
Instead of just passively taking treatment, patients become active participants in their own healing journey.
Right.
It's a really exciting vision.
It is.
One that could totally change how we think about healthcare.
Absolutely. It reminds us that we can always learn and grow.
From both ancient wisdom and modern science. This deep dive into the Ayurvedic approach to managing liver disease has been truly eye-opening.
It has.
We've explored Ayurveda's unique perspective, looked at the science behind specific treatments, and even thought about what the future of healthcare could hold.
Lots to ponder.
Definitely. But before we wrap up, I want to leave our listeners with one final thought.
Okay.
If you're thinking about incorporating any Ayurvedic principles or treatments into your own health journey, please talk to a qualified practitioner.
That's really important.
It's crucial to have someone who can guide you and make sure you're safe.
Definitely.
All right, folks, that's it for this deep dive.
Thanks for having me.
Thanks for joining us on this journey of knowledge and discovery.
My pleasure.
Until next time, stay curious, keep learning, and take good care of yourselves.